Hello, future nurses. It's Sir Josh here. Today, we're going to discuss the continuation of our adrenal glands disorder. So, we're already done with your Cushing's disease. And now, we're going to discuss your Addison's disease. So, madali lang po yung Addison's natin. Pag sinabi natin Addison's disease, this is just the, this is just the opposite of your Cushing's disorder or your disease. Ngayon, pag sinabi natin Addison's disease yan, class, it is just the tinatawag natin na hyposecretion of your adrenal hormones. Okay? So, yung ating Addison's disease class kasi naka-cluster kasi yan, it depends kung ano usually yung nagkaroon ng problem when it comes to the process of producing your three hormones, which is your glucocorticoids, your mineralocorticoids, and of course, your sex hormones. So, with that, okay, we're going to first discuss yung ating the process wherein how does your three natural hormones, namely your GC, your MC, and your sex hormones, were being released by our adrenal cortex. Diba una muna, we have your what? We have your hypothalamus. Okay, your hypothalamus, okay, will release your what? Para ma-stimulate po natin ang ating anterior pituitary gland, it will going to release yung tinatawag natin adrenocorticotropic hormone releasing factor. Okay? And after that one, after releasing this ACTH-RF, it will going to stimulate your anterior pituitary gland. Okay? Wherein your anterior pituitary gland class, it will going to release yung tinatawag natin na adrenocorticotropic hormone or your ACTH that will what? That will further stimulate your adrenal cortex to release your three hormones natin. Namely, we have your GC, okay? We have your mineralocorticoids, and last will be your sex hormones natin. Okay, so that is how the process, no? Kung paano pa natin nasa-secrete or paano pa na-produce ng ating adrenal cortex yung tatlong steroids natin or the natural steroids in our body. Ngayon, pag sinabi nating primary yan class, it's either lalagyan natin to ng number. How we have here 1, 2, and then your number 3. Ngayon, pag nagkaroon po ng problem with our hypothalamus, okay, particularly, no, usually naman ang cause naman ng kung bakit nagkakaroon ng damage, no, with our hypothalamus is usually vehicular accident yan. Pag nagkaroon ka ng problem with your hypothalamus, nasira ang hypothalamus mo, makakapag-release pa tayo ng ACTH-RF natin, ng ating releasing factor? No. Pag wala pong releasing factor, wala pong mag-stimulate sa ating anterior pituitary gland, and therefore, kulang na po yung tatlong steroids natin, namely your GC, your MC, and your SH. Ang tawag natin doon is your what? Tinatawag natin siyang tertiary Addison's disease. Kapag hypothalamus ang nasira dito sa ating katawan. Okay, next naman tayo class, pag nasira naman po ang ating anterior pituitary gland, okay, yes, okay ang hypothalamus, may intact ang hypothalamus, nakakapag-release ng ACTH-RF, but pag merong problem, no, with our anterior pituitary gland, makakapag-release ka pa ba ng ACTH? No, pag walang ACTH, hindi ma-stimulate ang ating adrenal cortex, therefore, walang release ng ating or walang production ng ating tatlong natural steroids. So, pag secondary yan class, ang problem is in our anterior pituitary gland natin. Next naman po, kapag mismo, okay, ang ating adrenal cortex ang nagkaroon ng damage, yes, okay, intact ang hypothalamus, intact ang ating anterior pituitary gland, but merong problem with our adrenal cortex, what will happen? Makakapag-release pa kaya tayo ng tatlong hormones? Definitely, hindi na po. That's why ang tawag natin doon is your primary Addison's disease kapag ang ating adrenal cortex ang nagkaroon ng problema. Okay, there's something in common with this one class. Pag nasira, okay, nasira naman ang ating hypothalamus, nasira ang ating anterior pituitary gland, nasira ang ating adrenal cortex. So, meron tayong tatlong causes na pwedeng sumira ng tatlong yon. Ano yung mga yun, sir? We have your TIT. Anong TIT9? First, we have your trauma. Okay, nagkaroon ng trauma in your hypothalamus, in your anterior pituitary gland, in your adrenal cortex, therefore, decrease ang release ng ating adrenal hormones. Aside from that one, nagkaroon tayo ng possible infection. Again, aside from that one, last one will be your tumor. Okay, nagkaroon ng tumor formation. That's why itong tatlong trauma, infection, and tumor, they can actually damage yung mismo, or they can actually alter yung production ng ating tatlong hormones. Okay, so let's proceed with our simple pathophysiology. No? Dito tayo sa ating pathophysiology class. Sabi natin, in contrary with our discussion with Addison's, okay, sa ating Cushing's, lahat increase. In your Addison's naman, lahat ay decrease. So, ganito po yan, okay? Since decrease po yung tatlong production ng ating hormones, decrease ang what? Decrease ang glucocorticoids, decrease ang mineralocorticoids, and of course, decrease din po ang ating sex hormones na tinatawag natin. Ngayon, pag decrease ang ating glucocorticoids, sabi natin before that your glucocorticoids enhances the process na tinatawag nating gluconeogenesis. Ano bang ibig sabihin ng gluconeogenesis? Formation of your glucose. Okay? Pag decrease po, ngayon, ang ating glucocorticoids, decrease din po ang formation ng bagong mga glucose natin that will be needed by our body. That's why, anong mangyayari sa blood sugar natin? Nagkakaroon po ng pagbaba ng ating blood sugar level. Kaya yung mga patient na mayroong Addison's Disease decrease ang kanilang glucocorticoids, nagkakaroon po sila ng tinatawag na hypoglycemia. Okay, that's why, no wonder yung mga patient na mayroong Addison's disease, since meron silang hypoglycemia, makikita mo sa kanila, class, is that what? Makikita mo sa kanila, nagkakaroon sila ng profound weakness. Okay, nagkakaroon po sila ng profound weakness or nangihina po yung kanilang katawan kasi bakit? Wala po silang enough na glucose in their body. Okay? Next naman tayo here with your mineralocorticoids. Okay? Pag decrease ang mineralocorticoids natin, ano ba yung involved dito? Pinaka-primary na hormones natin dito. We have your what? We have your tinatawag natin na aldosterone. Para saan ulit si aldosterone? Si aldosterone ay tumutulong for sodium retention and of course water retention. Ngayon, isipin mo mababa ang mineralocorticoids mo, mababa ang aldosterone. What will happen to your sodium? Meron pa ba tayong ma-retain na sodium? Wala. Kaya sila nagkakaroon ng decrease in the level of their tinatawag na sodium, nagkakaroon sila ng hyponatremia. Okay, pag nagkaroon si patient ng hyponatremia, walang nare-retain na sodium, sabi natin ang ating sodium, wherever your sodium goes, your water follows. Pag walang nare-retain na sodium, meron din bang ma-retain na tubig? Wala. So, labas lahat ng water from our body. That's why si patient nagkakaroon ng risk to develop what? Fluid volume deficit. Okay, pag nagkaroon ng fluid volume deficit si patient, lumalabas lahat ng tubig, what will happen to our body? Okay, magkakaroon sila ng tinatawag na hypovolemic shock. Okay, they have higher chance to develop your hypovolemic shock. Okay, ngayon, pag nagkakaroon tayo usually ng hypovolemic shock, ano bang organ ang nagko-compensate? Di ba yung organ na nagko-compensate pag nagkakaroon tayo ng shock? It's your heart. Ang delikado ngayon dito sa ating Addison's, okay, that's why it makes it very, mas mahirap i-control or mas delikado ang ating Addison's compared sa Cushing's is because aside from that one, sabi natin pag nagkakaroon ng hypovolemic shock, ano nagko-compensate na organ natin? It's your heart. Okay, nagko-compensate po yung ating heart. Ngayon, yung ating heart class, since nagkakaroon ng problem when it comes to our potassium level, di ba? Okay, sabi natin your sodium and your potassium, they are inversely proportion with each other. So, pag tumaas si sodium, bumababa naman po yung ating potassium. Ngayon, bumaba ang ating sodium in the case of your Addison's disease, tataas naman po yung ating potassium level. Kaya si patient na merong Addison's, nagkakaroon po sila ng tinatawag na hyperkalemia. Okay, so ano makikita natin sa interpretation sa ating ECG? Pag meron kang hyperkalemia, it's your what? It's your, okay, tall peak T waves. Nagkakaroon po sila ng tall peak T waves when it comes to the interpretation of their ECG natin. Ngayon, aside from that one class, since ang ating potassium, sabi natin, it is responsible for what? Responsible yan for what? For your contractility of your heart. Okay, ngayon, since masyadong mataas ang potassium ng ating katawan, anong mangyayari sa heart natin? Nagkakaroon po yan ng spastic paralysis. That's why yung patient na merong hyperkalemia, nagkakaroon po sila ng spastic heart na tinatawag. Okay, pag nagkaroon ng spastic or spasticity yung heart natin, pwede bang mag-stop yung pag-contract ng heart natin? Yes, that's why pag nag-stop ang pag-contract ng heart natin, delikado po yan. Yung patient will suffer what? Your patient will suffer from cardiogenic shock. Okay, pwede silang magkaroon ng cardiogenic shock. And ngayon, pag pinag-combine natin to class, okay, pwede bang mangyari yun? Yes, sir. Pag pinag-combine mo, okay, nagkaroon siya ng hypovolemic shock, nag-compensate ang heart dahil masyadong mataas ang ating potassium level, what will happen? Magkakaroon ng spasticity of the heart or spastic paralysis. Pag nag-stop, mag-contract ang heart, delikado ba yun? That's the time na nagkakaroon siya ng tinatawag na cardiogenic shock. And pag pinag-combine mo, hypovolemic shock, okay? Hypovolemic shock plus cardiogenic shock, what do we call that one? Tinatawag natin silang irreversible shock. That's make your Addison's disease as more dangerous compared sa ating Cushing's. Okay, aside from that one class, since decrease po yung level ng ating sex hormones, okay, of course, expected sa mga patient na mayroong Addison's what? Okay, decrease ang kanilang libido. Okay, and aside from that one, since pag lalaki ang patient na nagkaroon ng Addison's, pwede silang magkaroon ng erectile dysfunction. Okay, ay dapat yan, erectile dysfunction in patients, okay, in male patients who have your Addison's disease. Okay, aside from that one, sir, bakit kaya nagkakaroon ng tinatawag na bronze skin like yung mga patient natin, no? Meron silang bronze skin-like yung mga patient natin na merong Addison's. Ganito yan, di ba? Yung ating hypothalamus class, okay, it will going to stimulate your anterior pituitary gland through your what? Through your ACTHRF or your releasing factor para ma-stimulate yung ating anterior pituitary gland. And your anterior pituitary gland will what? Will release your adrenocorticotropic hormone. But then, pag mayroong problem, okay, when it comes to our, Addison's, since mababa lahat, ano mangyayari? Okay, so mangyayari dyan, class, di ba? Normally, yung ating adrenocorticotropic hormone, it will going to stimulate your adrenal glands, okay, specifically your adrenal cortex, to release your GMS, your glucocorticoids, your mineralocorticoids, and your sex hormones natin. But pag nagkaroon ng problem, class, okay, ano mangyayari? Hindi lang po ACTH ang pwedeng i-produce ng ating anterior pituitary gland. Kasama po natin yung tinatawag natin na melanocyte-stimulating hormone. Okay, yung ating melanocyte-stimulating hormone, ano ba ang kanyang target organ? It's your what? It's your skin. Ang ginagawa nito is that it increases the melanin production in your skin. And alam naman natin ang ating melanin ay tumutulong yan for what? Responsible yan for the dark pigmentation of your skin. That's why yung patient natin nagkakaroon ng bronze skin like. Okay, next naman tayo here with your decrease. Okay, since in general, decrease ang glucocorticoids, decrease ang mineralocorticoids, decrease din po ang ating sex hormones. That's why pag decrease po ang ating steroids, okay, since ang ating steroids, they are considered as what? They are considered as immunosuppressant. Okay, so same with your Cushing's. Okay, pag decrease ang steroids natin, decrease ang tatlong yan, si patient, tendency magkaroon niya ng tinatawag na severe bumababa ang kanilang level ng kanilang anti-inflammation or anti-inflammatory. Pag bumaba ang kanilang level ng kanilang anti-inflammatory, what will happen? Of course, your patient is already at risk for infection. Pwede silang kaptan ng maraming mga mga opportunistic infections. Aside from that one, since ang ating anti-inflammation, di ba, meron silang what? Meron silang meron silang analgesic property. So, pag decrease ang tatlong steroids natin, decrease din ang ating anti-inflammatory response, what will happen to our patient? Tendency yan, mas mataas ang kanilang sensitivity to pain. Okay? So, pag naghalo-halo natin to, class, okay, your hypovolemic, una muna, number 1, we have your, pag si patient nagkaroon ng profound weakness, okay, wait lang, class. Pag si patient nagkaroon ng profound weakness, number 1, aside from that one, nagkaroon siya ng irreversible shock, including your hypovolemic shock and your cardiogenic shock. And of course, pag nagkaroon niya ng tawag dito, pagbaba lahat ng ating steroids, what will happen? Si patient ay magkakaroon ng tinatawag na, okay, ano yung pinaka-complication of your Addison's disease is your what? It's your, ulit natin, complication of your Addison's disease. Tinatawag po natin siyang Addisonian crisis. Okay, nagkakaroon siya ng tinatawag na Addisonian crisis. Or para hindi kayo malito, baka kasi malito kayo, no? Ang other term po natin for your Addisonian crisis, tinatawag din po natin siyang adrenal crisis. Okay, so now let's proceed with our management naman po. Okay, sa ating management, ano pa yung mga ibibigay natin, okay? Of course, what we're going to administer is your what? IVF as ordered. Bakit? Okay, bakit magbibigay tayo ng intravenous fluid kay patient? Kasi nga nagkakaroon siya ng fluid volume deficit due to your what? Due to your hyponatremia, walang na-retain na sodium, therefore walang mare-retain na water inside our body that will lead to what? Fluid volume deficit, and of course, that will eventually lead to hypovolemic shock. Kaya magbibigay tayo ng intravenous fluids. Aside from that one, pag si patient nagkaroon ng what? Nagkaroon sila ng profound weakness due to your hypoglycemia, we're going to give your hydrocortisone intravenously. Okay, to replace what? To replace the lost glucocorticoids. Okay? Aside from that one, bakit tayo magbibigay ng NSS? Okay, as part of your intravenous fluid, bakit kaya NSS ang bibigay natin? Normal saline solution. It's because your NSS contains what? It contains salt in your water as well. Okay? So, yan pa yung maibibigay natin kay patient as prescribed by your attending physician. Next naman po tayo, what are we going to monitor? And of course, we're going to monitor the fluid balance of our patient. Bakit? Kasi nga sabi natin nagkakaroon siya ng fluid volume deficit. And of course, aside from that one, we're going to monitor for the intake and output of the patient since nagkakaroon siya ng tawag dito deficiency when it comes to the sodium retention. Of course, nagkakaroon din ng problem sa paulit-ulit, diba? Nagkakaroon din siya ng problem sa water retention. Kaya yung patient natin na merong Addison's, ihiyan ng labas lahat ng tubig sa kanyang katawan. That's why you have to monitor for the intake and output of your patient. And aside from that one, when it comes to your USG, since labas ng labas, okay, ang ihi ng patient ng ating labas ng labas ang tubig sa ating patient, okay, pagdating sa ihi niya, diluted masyado, therefore, decrease ang kanyang urine specific gravity. And of course, pagdating sa weight, okay, pag hindi natin kaya i-monitor ang kanyang intake and output, okay, hindi natin kaya i-monitor ang kanyang fluid balance. So what this one, your weight is an indicator or the best indicator that you could actually monitor your tawag dito status ng patient natin pagdating sa kanyang fluid, okay? So another trivia, no, just to remember this, you have to remember this one, okay? That your 1 cc or 1 ml is actually equivalent to what? 1 kilogram. Okay, tandaan niyo ito, 1 cc or 1 ml is actually equivalent yan sa 1 kilogram. So for example, nagkaroon siya ng what if nakapag-loss siya ng 1,000 ml in his body, okay, or 1 liter. Okay, di ilan ang na-loss niya na weight. Okay, so that's why mas magandang indicator yung weight natin when it comes to assessing your fluid balance natin. And of course, pagdating sa natin, since labas lahat ng tubig, therefore nagkakaroon sila ng decrease in their weight, nagkakaroon ng profound weight loss. And of course, pagdating sa lab studies, ano yung mga importante dito naman is that your what? Your sodium and your potassium. But mas importante din yung ating potassium. Bakit? Okay, mas delikado yung potassium kasi nga pag nagkaroon ng electrolyte imbalance, specifically your potassium, ang inaapektuhan niya is yung heart natin. Okay? And of course, you have to advise the patient to gradually change position. Bakit? Since nagkaroon siya ng fluid volume deficit, what will happen? Okay, mas mataas ang chance si patient magkaroon ng what? Postural hypotension. Okay, mas mataas ang chance niya na magkaroon ng postural hypotension. And aside from that one, you have to encourage fluid intake. Increase natin ang fluid intake dahil lumalabas lahat ng tubig sa katawan. Okay, you have to assist with activities of daily living. Bakit? Since decrease ang ating glucocorticoids class. Therefore, nagkakaroon ng profound weakness yung patient natin. Due to what? Due to hypoglycemia. That's why mabilis manghina yung patient natin, no? That's why you have to, kung as much as possible, dapat bigyan mo ng interval when it comes to performing their activities of daily living. You have to assist them. And of course, dapat may interval yan. Kasi the more na yung patient natin, pinapagalaw yung patient, okay? The more din na gumagamit yan ng ng ating glucose in their body. That's why, since decrease ang glucocorticoids, nagkakaroon sila ng hypoglycemia that will lead to profound weakness. And of course, you have to decrease the stress. Bakit? Kasi, yung patient natin, the more na stress yan, mas gagamit niya na madaming glucose. And aside from that one, yung patient natin, medyo nagkakaroon sila ng problem when it comes to, adaptability, no? Pagdating sa stress, hindi nila yan natotolerate. That's why you have to maintain calm environment. Okay, you have to maintain calm environment for your patient who have your Addison's disease. So that's it for our discussion for our Addison's disease.